So essentially, the thing that you need to know, this last Friday, just a few days ago, I called for an investigation into the three major healthcare systems here in Idaho. I'm going to walk through some of the reasoning why I did that. But since then, I've done a little bit more homework on the healthcare systems, and I've found some surprising things that I think the community ought to know as we have this discussion. But the first thing that I want you to know is I sent out a press release to all the major news outlets in Idaho on Friday, because on Friday is when I called for the governor to start an investigation into the healthcare systems, because they've received so much federal money. We're talking, folks, we're talking hundreds of millions of dollars they've received in federal money through these federal funds, like the COVID-19 Coverage Assistance Fund and the Provider Relief Fund, all these different funds. So our healthcare systems in Idaho received hundreds of millions of dollars. In fact, St. Luke's alone has received almost $130 million of our tax dollars. And I think it's prudent, anytime we're going to hand over hundreds of millions of tax dollars, that there should be an accountability factor. There should be audits and investigations to ensure that we have transparency and that people are doing what we expect them to do. It is only prudent. But we live in a time now where anybody who questions any expert is somehow anti-science or ignorant. You get mocked and scorned for asking basic questions, and it's beyond my understanding, because we're the bosses here, folks. We're the ones who paid the tax dollars for the politicians to turn over to the healthcare systems to make sure that we were all going to continue to receive healthcare during this pandemic. The question that I have, and I've connected with a lot of physicians, did the hospitals change their processes so that they would in turn receive more money from the federal government than they otherwise would have? Is it possible that they over-reported the number of cases so that it was tied into the compensation from those federal taxpayer funds? I don't have the answer to those questions right now. I have a guess. I think I know. But at the end of the day, we deserve the truth. So I'm raising some important questions. Get this. So I send out a press release to every major news outlet in the state, television, papers, everything, on Friday. Here's my question. Did any of you guys hear about me calling on the governor to investigate the healthcare systems during the recent pandemic? I know the answer. We have some good publications that did cover it. There are starting to be some Idaho-based publications that are more non-biased, that are willing to put this stuff out there. So I got to thank the Gem State Patriot, Idaho Dispatch, True Idaho News. At least some people are covering what's going on and trying to deliver you the truth. And the Idaho Code empowers the governor to require either the attorney general of the state, which I wouldn't expect really to go anywhere, or the prosecuting attorney of any county to investigate a corporation, the management and the affairs of a corporation. That's why I think it's prudent for our current governor here in Idaho to make that happen and make sure that there's accountability built into the system. But more importantly, if we discover that they were, as I expect, that the executives, the management of some of the healthcare systems were not totally truthful, then we have to question everything else that we've been told, because we have trusted blindly trusted the experts this entire time. And now when we start asking hard questions, the media wants nothing to do with it, and I become some fringe individual for even mentioning that I think we should investigate hospitals. And for those of you, because I know some people think this has, I'm criticizing the staff or the nurses or the physicians. Folks, I'm not. Remember, my wife's a nurse anesthetist. My mother's a nurse. My aunt's a nurse. I mean, I've been surrounded by nurses my whole life. Some of my closest friends are physicians. You have your frontline people that are doing an incredible job, doing their best to take care of us. But remember, we have executives that have a bottom line to consider. And I want to share something from with you right now that I found about the health systems, so that you can make a determination for yourself if you believe that these healthcare systems are just these nonprofits that are set up only to benefit the community and take good care of us all. Here's from the most recent Form 990 that St. Luke's filed. And there's a number of different organizations that St. Luke's has, and they all file different forms. Here's what you need to know. The CEO at that time, which has changed, but I imagine that the number is even higher. The CEO in 2019, when this was filed, his annual compensation was $8.5 million. That's not including other benefits. That's $8.5 million. There's other compensation in there too. Think about that. Folks, this isn't like Mother Teresa running a hospital. These are corporate types that get compensated incredible amounts to manage these healthcare systems. So here's the question that we all deserve an answer to. Is it possible that the healthcare system executives, in an effort to increase their earnings, lied to us or manipulated this pandemic to make their hospital systems larger and get more money? Because here's what they'll argue. They'll say, well, you know, an $8.5 million a year salary makes sense because of how much money passes through these systems. And all right, I can kind of understand that. But even more to my point, if they could be in a situation where they say, hey, we could vastly increase our budget and take more federal dollars, and then because our salaries are tied to that, our salaries would go up. I think that's entirely possible. It is irresponsible for anybody in state government to not call for an investigation into St. Luke's, St. Al's, and primary health. This is not a fringe issue. The taxpayers have the right to know, was our money used properly or improperly? Were we lied to in a scheme to receive more of our tax dollars? And you now have a solid reason why I think we ought to consider it. I mean, even in this Form 990, which I believe is just for the St. Luke's Regional Medical Center, so it doesn't include St. Luke's Health Systems and many other organizations affiliated with in the St. Luke's system, that this one alone reports that they've paid $52 million in a year to management, not including the other organizations, $52 million a year. Folks, like I said, this isn't Mother Teresa running this thing from the goodness of her heart. These are corporatists. It is time for the people to start speaking out. You all need to stand up for our healthcare professionals that are on the front line with this vaccine scheme. Those healthcare systems get federal funds when they administer the vaccine if they don't get compensated through other means. They're guaranteed to get paid. So is it a conflict of interest for them with St. Luke's alone, third largest employer in the state of Idaho, not including contractors. St. Al's, eighth largest employer in the state of Idaho. So you take those three healthcare systems, I have to ask, is it a conflict of interest to mandate that your incredibly large workforce get a medical treatment, and then you are also the one who gets compensated for providing that service? That looks like a scheme to me to vastly increase revenues. Here's another question. All three of those healthcare systems came out on the same day mandating that their employees receive that treatment. Was that coordinated? I think the answer couldn't be more clear. That is beyond coincidental that all three on the same day came out in that way. So when you're making that major of a labor policy change, we need to know, is this anti-competitive behavior by these three healthcare systems? I believe the investigation should also ask that question and give us an answer if the health systems colluded together to make these major policy changes that they would then benefit from. So just remember, just because you're a nonprofit has nothing to do with compensation of executives and everything else. well, I shouldn't say nothing. I mean, the reality is you're not going to receive, stock options. But nonetheless, I think you can see the nonprofit world can be a very lucrative world for a lot of corporate types. So that's the bulk of what I wanted to share with you guys today. I appreciate you tuning in. We need to spread the word on this, please. I'm getting shadow banned on Facebook like crazy. This video, no one else will see this video you're watching right now if you don't share it. So right after the video is done, I'm going to post it on the Humphreys for Governor Facebook page. And if you don't share it, other people will not have the opportunity to have these conversations. But most importantly, you need to be reaching out to the media. Why are the television stations and the newspapers not wanting us to have this discussion? The governor is within his authority to require an investigation be carried out. I call on Idaho's governor to do the right thing for the taxpayers. If he's a fiscal conservative, then he should want to make sure that our tax dollars are being managed appropriately. Thank you guys for tuning in. Share, reach out to media outlets, and sign up, edforidaho.com. If you want to join this fight, if you want to have a voice and you want to start getting to the bottom of these things, then please, edforidaho.com, sign up to be a volunteer. We will not let you fall through the cracks. You can be on the front lines of this fight very quickly. Thank you guys. Take care.